Hello, everyone, and welcome to our third Ask a Clinician webinar series. Thank you so much for coming along. And lo and behold, I'm here again chairing. We were supposed to have Alex Chung chairing today. Unfortunately, got lost somewhere in the ether. I don't know what's going on with him. I will have to chase this up with him. Digital gone wild. So I've been asked to step in again, which, as last time, I do not mind. And we have a fantastic speaker today who I'm very excited to hear from. We've got Ramandeep Kaur. This time I get her surname right. She's talking to us about her role as a CCIO and a pharmacist. Let me give you a bit of a background from her. So her passion for clinical informatics, digital healthcare, whatever you like to call it, stems from her first role as an EPMA pharmacist in 2014. She is the current CCIO, group CCIO, so Chief Clinical Informatics Officer at University Hospitals of Northamptonshire. She completed the Digital Health.London Pioneer Fellowship Program, and I was a student with her on Cohort 4, the NHS Digital Leadership Academy course. She's proud to be currently an advisory panel member of the CCIO Digital Health Network, a member of BCS, RPS, Shuri Network, and UKCPA. Ramandeep, the floor is yours.
Good afternoon, everybody. Thank you very much, Mark, for that introduction. Hopefully you can hear me.
Yep.
Brilliant. That's good. Excellent. Hope everyone's having a lovely afternoon and hope it's sun shining wherever you are. It rained on my way to work this morning. So let's hope the sun has come out. So thank you for giving me the opportunity today to speak to you all. I am going to share my screen and hope that this works, because I know that last time we had a couple of difficulties with technical issues. Let's see. This is the point where you see your face on the screen, don't you? And there we go.
Fantastic.
Can we see
Thank
that?
you. Yeah.
Brilliant. Okay, so thank you very much for inviting me along to speak, and I'm going to hopefully give you a little bit of an insight today into the role of a CCIO, a little bit about electronic prescribing and medicines administration, a little bit about EPR, and a conclusion. And everything that I'm going to talk about today is from my perspective and the way that I see things, but I completely recognise that there may be others on the call who will have different perspectives to these things, which is always great to hear from different people. Okay, so the first thing I'm going to do is take you on a little bit of a journey, really, to kind of discuss sort of the route and how I've got to becoming a CCIO. This is definitely a route that I never envisaged that I would take. It's come with a lot of learning along the way, no doubt. And when I qualified back in 2012, which was quite a while ago, I never even thought about digital as a career. It wasn't something that was advertised. It wasn't something that was on the radar as a trainee pharmacist, and happy to speak later about that kind of transition and grassroots education for bringing digital into that, something which I'm really passionate about. So when I qualified back in 2012, I was working at Leeds Teaching Hospitals, and then I went to medical school for a year. That experience definitely changed my entire life and gave me an opportunity to really kind of learn about me and develop as an individual, both from a personal perspective, but also professional perspective. And for me at that point, I kind of really realized how much life was learning was a lifelong process, and I was really curious about what was going on around me and what were my next steps. So medicine I only did medicine for a year, but I didn't stop questioning as to what I was going to do next. And I was in Leicester and I saw this job come up for an EPMA specialist pharmacist, and my take on it was I really like computers. So we're going to apply for this job and we're going to see what happens. And that's where the career started, really, back kind of loving computers and thinking I'm going to dip myself into digital. And I wasn't quite so sure where I was going to go. I thought that would just be a short-term role. And I'd set myself some really high ambitions of becoming a chief pharmacist by the time I was 40. And I'd really kind of gone, I'm going to be this grade and that grade, etc., etc. And clearly, I'm not a chief pharmacist at the moment. And that inquisitiveness and that curiosity is what has led me into the roles that I have had now within digital over the last 10 years. And I think the quote that's on the screen really resonates with me about how fast things do evolve and how fast things can change. So that was kind of between 2014 and 2016. I was doing this EPMA specialist pharmacist role at Leicester, which at that time I thought was just going to be for a couple of years. What I didn't know was that was going to be actually the cement for my current roles. So roll on to 2016 to 2022. And a lot has changed. And I realized that I absolutely love digital. And it wasn't something that was going to be short term anymore. It was something that I remember going in 2016 to the Clinical Pharmacy Congress and presenting a paper on vancomycin and an audit that we'd done utilizing the digital technology that they had at that time. And I felt really inspired because I could really see how digital could make a difference. So for me, for those of you that are listening, and I appreciate there's lots of different people on this call, there'll be people who are clinical, there'll be people who are in digital roles, is certainly a take-home point around going away and speaking to people and networking with lots of different people, because actually you're not necessarily going to realize what you fall into, or you won't necessarily realize people's different journeys. And at that point, when I realized that it was a career in digital that I wanted to do, I then took on my next role whilst I was at Leicester and led a team of people to then roll out electronic prescribing and medicines administration to 120 clinical areas between 2018 and 2019. And when I first qualified and I was at Leeds, a friend of mine and a colleague gave me this book called The Art of Being Brilliant, and I would recommend that as a read. And it talks about not changing who you are, but finding out what works for you. And those years were certainly some of the years where I have found out what works for me, and actually really trying to go about it and doing it with all the good intention that we all have in our roles. And that's really where that drive and ambition and the word cloud that you can see on the slide kind of really resonates with me in terms of growing that desire and love for the field of digital innovation and informatics. So I then went, after my career at Leicester, I took a slight sidestep. Whilst I was their advanced specialist pharmacist for electronic prescribing, I then took a sidestep to go back and do education and training and a split with surgery. And I know last time you had a talk from Saboth around his role in vascular surgery, and ironically, or coincidentally rather, my role within surgery and one of the surgical areas that I really love is also vascular. And I took that role and that split because I kind of wanted to dip back into being clinical and also have a little bit of education and training. And that certainly for me was really important. And one of the things I would say to anyone listening that don't feel that you can't go and take another role and come back into digital, it really is something that it worked really well for me. And then after that, I went on to be the lead digital pharmacist for EPMA at Barking, Havering and Redbridge, and that was from 2020 to 2022. So quite a lot of experience there around electronic prescribing and medicines administration, and I'll come on to talk a little bit more about that. And I think for any pharmacist colleagues that are listening, that is certainly something back then that was very much the route around a pharmacist getting into digital. It is all about electronic prescribing and medicines administration, and I kind of want to hopefully show you throughout this presentation today that things have changed as well, which is really great to see, and that journey has changed for individuals, and it isn't just about EPMA, but it is still fundamentally an integral part. Along the way, there's obviously been some challenges, and not everything has been easy. And I've applied for things that I haven't got. For example, when the FCI first formed back in the day, and it was in its infancy, I didn't get a place. I was unsuccessful for one of their fellowships back then. However, things did change, and I've persevered quite a lot within that and developed some of the expertise that I needed to then become part of those forums, and that has really stood me in good stead, and then kind of given me all the experiences that I've had to date. So as you can see on here, fundamentally for me, what's really important is the patient experience and the experience of our staff. And that is one of the real reasons. And I know sometimes that can be sort of seen as a cliche, but it is the real reason why I come to work every day. And it's really, really important for me. So along the way, I've obviously spoken very briefly about my experiences as EPMA pharmacist at Leicester, and then same experiences at Barking, Havering and Redbridge, where I was their lead EPMA pharmacist and project manager as well. And then in 2022, I took my first step into the world of being a CCIO and becoming a CCIO for all healthcare professional groups. And there are very few pharmacists in the country that have got this role. And I think for me, what I would really like to convey to people on this call today is about breaking those glass ceilings and breaking those barriers down, because absolutely anything is possible. Any one of you, depending on what role you're in, can break those norms. And there's some people along the way who have been an absolute inspiration to me in order for me to be able to get to where I've got to today. As Mark rightly pointed out, along with that, though, has come a lot of education that has been done. So I have a master's in leadership and innovation, and I was on the Digital Health.London Pioneer Fellowship Programme, and I've done the Digital Health Leadership Academy Cohort 4. I've also been really fortunate to have opportunities to speak at Rewired, and I've done a lot of work and summer schools and other conferences, and I've done a lot of work with colleagues, and I'm going to mention a couple of colleagues here, Sarah Thompson, Ewan McKimsky and Melissa Anderson, who are all very good friends of mine, but also AHPs and pharmacists who have worked within this field to really bring out digital and kind of bring that to the forefront. Sometimes people kind of have overlooked potentially HPs and pharmacy, and we really wanted to bring that to the fore. And we're really proud that this year at Rewired, there was a actual digital AHP and pharmacy summit named in its own right. And we've worked really hard to be able to achieve that. I am on the advisory panel, as Mark said, so I'm on the Digital Health CCIO advisory panel and the only pharmacist that is currently on there, again, which is great. And hopefully, if there's anyone listening right now, we have a digital clinical leader survey out at the moment, and that is for the most in each of your organizations for a digital clinical leader to complete that survey, so we can get a bit of an understanding around workforce, what people want to see for the future, around accreditation, where you think the gaps are, in terms of your teams and the different roles that people are undertaking, because all that information is really valuable and really ties into the work that I do as a CCIO. And then I am also currently part of the Shuri Network, and now the BCS after the FCI is no more currently. And that's really powerful. And I've done a lot of work as well, mentoring others, which is really important for me to be able to give back to the community. And so that's a little bit about my role and where I've got to, and how I'm in the position that I'm in currently. What I thought I'd do is now give you a bit of an insight into the role of a CCIO. I'm not going to dwell on this slide too much, but this kind of really sort of showcases the team that I work within and the team that I head up at Northamptonshire, which comprises of both Kettering and Northampton hospitals. There's quite a lot of us. And we do have a clinical safety officer. We've got chief clinical information officers who focus particularly on the medical side on both sites as well. And we've got a number of posts in relation to our electronic patient record. And for me, what's really important about being the group chief clinical information officer is that I get to have a really broad portfolio of work that covers all healthcare professional groups. So it's really exciting to be able to step away from what was very much a pharmacy world and embrace that digital world, but not leave behind the pharmacy piece that will always be within me. So there may be some CCIOs on the call who will say that some of the work that they're involved in is different to the work that I've got on these service tiles that I've got on the screen. But a little bit around the things that I get involved in are around clinical safety, patient safety, risks, incidents, clinical engagement, which I absolutely love. I really enjoy being out on the shop floor. This morning we've been out doing a maternity paper picnic, which has been actually really great, and especially when you've got some freebies. Pens go down a real treat, and crisps and biscuits. But I really do enjoy the clinical engagement side of my CCIO role, which I admittedly wouldn't have done as much of when I was purely in pharmacy, because you're kind of very sort of siloed in what you're doing. I do a lot of work around adoption and optimization, looking at our current clinical systems and how we can improve those, but also working on our new electronic patient record that we're hoping to implement starting next year. Benefits realization and communication are also things that fit within my portfolio, and something that I'm really passionate about, especially that communication and engagement piece. And without the benefits, we never get a business case through, as I'm sure those of you on the call are familiar with. But if you're not familiar with that, and you work very much more in a technical role, I think it's really important to be able to recognise that your clinical colleagues will want to know what the benefit of doing something is within the clinical system and how that kind of marries up together. And likewise with patient safety and clinical safety, again, sometimes it's really easy to kind of go, actually, we want this technology and we want it now, but there's all the digital governance to get through, which I necessarily wouldn't have had so much exposure to when I was purely in my EPMA pharmacy roles, but I've certainly developed that exposure now within my role as a CCIO, and all the things around DPIAs and data security, cyber assessments and clinical safety assessments, which I'm sure you can ask questions about, no doubt, in the chat if you want to know more about those. And then last but not least, in the tiles is also digital literacy. And actually, I like to call this digital confidence, which we've a term that we've embraced within the East Midlands. And something that we're currently really working on is not just about, because actually, if you said somebody's digitally literate, if you said they're digitally literate, it probably doesn't come across very well. So we're really looking to measure people's digital confidence, and that's a whole topic in itself. But again, something I'm really passionate about, because we almost sometimes can take it for granted that everyone knows how to utilize a computer or their iPhone or their iPad. So actually, how do we support people in that? Because their experience at home would be quite different perhaps to their experience at work. So again, those are some of the really high level things that I get involved with, and I work really closely with our digital transformation innovation team, our information communication and technology team, and our clinical systems team as well within digital. But without everybody else that's working in the organisation, I certainly couldn't do my job. And I'm very much a bridge between our digital colleagues and our clinical, operational and administrative colleagues on the ground. Also working with our comms team, our finance team, our data security team, procurement, corporate, and not forgetting our external parties, including our GPs, our ICB, etc. Sorry, my screen's just flickering. I'm hoping that the technical issues there aren't any technical issues your end, and it's just my screen. I hope not. I think we're okay. And so teamwork's really important, and also not forgetting the patient's voice. And one of the things, again, that I kind of wanted to bring, and I'm not going to go through all of these projects at all, but I kind of really wanted to showcase that being a CCIO means that I'm involved and my team are involved in lots and lots of different projects, and not just things around digital medicines and pharmacy elements, because of the nature and breadth of the role. So we get involved in everything from nursing, midwifery, AHPs, pharmacy, medical, to things that impact our ward clerks, our community teams, etc. So that's a little bit about a whistle-stop tour around the role of a CCIO. And now I'm going to give you all a little bit of a whistle-stop tour into electronic prescribing and medicines administration. And the reason that I've chosen to focus on this is particularly because the session is very much titled Thinking about the Role of a CCIO, but also being a pharmacist. As I said previously, if you were to go and have a look now on NHS jobs, a lot of the roles within digital for a pharmacist or a pharmacy technician as well are very much around EPMA. And that is just the nature of those roles. I've got some vacancies at the moment, and within around these roles, but within our team, I've opted to title them differently. We've titled them digital medicines, and that's what we did with the FCI, the group that I was involved in there. We entitled the group the Digital Medicines Specialist Interest Group, as opposed to EPMA. Because the really important part for me, and really wanting to convey that today, is that your pharmacists and your pharmacy technicians will get involved in quite a lot more than just electronic prescribing and medicines administration. Gone are the days of potentially green pen, although I'm sure there are still some hospitals in the country that do not have electronic prescribing and medicines administration. Our trust is one of them. We're currently on paper and hoping to move across to a digitalized solution next year. Back in the day, there was all sorts of mantras that came through that said that we should all go paperless by a certain year. I think one of the earlier things I've seen was 2018. We're now in 2024, so we've still got some way to go. But I think what I want to do for the next couple of minutes is kind of join the dots between the digital piece, the technical part, and the clinical part, and how that comes together, and how people, if you're a person that's working in a technical role within digital, how do you see the role of a CCIO or the role of a pharmacist or the role of a technician working with you to fit that together, and what does it mean to you? Because from my end, it might make perfect sense, but to your end, it may not. And on that, I think what's really, really valuable is taking the opportunity to sit down and either shadow your colleagues and do some reverse shadowing, perhaps, because I think that's really important to have an understanding of what your technical colleagues are doing and vice versa, what your clinical colleagues are trying to achieve. So for those of you that don't know, electronic prescribing and medicines administration is a system that allows doctors to prescribe, nurses to administer, pharmacists to clinically review and order medications, pharmacy technicians to input drug histories they can order depending on permissions as well. And there's other members of the multidisciplinary team that can also access EPMA to carry out their duties within their professional capacity. For example, a dietitian might go on there to order some dietetic products, but again, those permissions would be very much restricted. And again, that's something for those of you that are working in a technical role, that are involved in working with colleagues that are looking at EPMA, will kind of be putting the dots together within the jigsaw piece, as it were, to ensure that you're giving the right RBAC permissions for the right individuals against the legislation that we are all governed by. And that's really important. The rollout and the implementation of an EPMA solution isn't easy. And I think what I would say is that a lot of these principles transfer over to a electronic patient record as well. And some of these steps that you can see on the screen, again, I'm not going to go through all of these in detail because I'm conscious of time, but as you can see, you've got that kind of infancy phase of conceptualization, and we're going to have this new fancy shiny EPMA system or EPR system, so an electronic patient record for those of you that may not be familiar with that terminology. And then you really go into that kind of project initiation phase. What does your spec look like? And that's really important as well. I've learned a lot about functional specifications that I certainly did not learn at pharmacy school. They do not teach you that because you go to learn about medications and anatomy, etc. Business cases, and that's really important. Perhaps one of the things for clinical colleagues on the call that we aren't well versed in, I certainly am not, and it's certainly one of the things that I would like to learn more about. And likewise, perhaps some of our technical colleagues may be not well versed in that either, but a real opportunity to kind of go out and seek those people that know lots more about that and getting involved in those opportunities if you can. And then you go through the procurement process, and obviously that can take a long while, irrespective of whether it's for an EPMA or an EPR. You eventually hopefully choose your system and go and complete your contracts and your full business case, and then you hit that pre-implementation phase, and that's where a lot of that work and the clinical colleagues and technical digital colleagues kind of come together to really work on that configuration, the all your permissions, all the building of a EPMA solution or an EPR solution come together, and then you go live, and then you think about your optimization and your benefits as well that you've foreseen. So on here, I've kind of touched briefly on a couple of the points, but from a pharmacist perspective, what's kind of really important in both, whether it be an EPMA or an EPR, would be around that kind of as-is process mapping. What are the things that we're currently doing? How are we going to change those processes from paper to digital? I know Saboth mentioned last time he was speaking around a lot of work that he's done around coding. I certainly don't have any of that experience at all. I will not claim to know to code, but there's clearly a lot now within solutions that you can automate and you can change. So it's really important to understand what your current baseline data is and how that is going to be moving forward and what that to be process looks like. Can you automate an order of medication because you've scanned the patient's wristband and you've scanned the box of drugs and it says they've only got 4 medicines left, and actually does it mean then really easily it's sent an order down to pharmacy already? And things like that, where you're kind of thinking in a really different phase rather than having to sit there and count everything and then order it on a piece of paper and get somebody to send it down to pharmacy. The other key elements are around engagement, which I've talked about earlier, that I'm really passionate about. And we've done, certainly in our organisation, we've done lots of digital roadshows that we kickstarted in December to really try and get people engaged. And we're now taking digital to the people, which is part of the reason of doing our paper picnic this morning. And we're introducing a new concept around digital responders so that we are actually actively going out and speaking to our colleagues who are working on our wards and in our clinical areas. And then really key from a pharmacist perspective is around system configuration and testing and building the drug file. That's something that traditionally isn't done within the digital team, certainly for an EPMA solution. And that's kind of something that really differs. So with your EPR, you will find that you've got your configuration analysts that are working on building your forms, your JavaScripts, your assessments, your care planning, your nursing assessments, your medical forms that need putting in, your AHP forms. But when it comes down to an EPMA, it very much is heavily reliant on that pharmacy resource to be able to really build those drug sentences from your British National Formulary. Fun fact, not quite, but there are at last count in 2018, there was a study that showed that there were over 237 million medication errors. And I was going to put up a Menti thing, but I thought it would take too long to see if anyone could guess the right number of how many errors there are. And it really is key to kind of really trying to reduce that number of medication errors. And we recognise that with all digital solutions, it will introduce new error. But it's really important, if you can, to do that pilot, to then be able to review that pilot, go away and do some retesting, have those go lives. Again, these principles are applicable to an EPR or an EPMA, and really getting that engagement and communication in with people. Adoption is really important too. And as you can see on the screen, there's going to be those people that are really up for this. And there's going to be those people that are like, no chance, not happening, and I've forgotten my password and I can't do anything. So really getting that engagement with people and managing that resistance and really trying to transform how you then manage things for business as usual, and getting that feedback from people is really important as well. And again, these principles apply for an EPMA or an EPR, but having your business as usual team is really key. I think funding challenges are across all of our NHS organisations and within primary care and in tertiary care as well. I don't want to forget my colleagues that work so hard who are not within our hospital settings. And that's really important to really bring that kind of external view together and really kind of maintain your systems across the board and have that interoperability where possible across your entire integrated care system to be bringing people together. I'm not going to dwell on these slides too much, but I thought I'd add them into the slide deck. So if there's anyone that's interested in knowing about closed loop medicines administration, this is something that is still quite a gap in the market, certainly from my opinion, around electronic prescribing of medicines administration and being able to barcode scan to get the right patient, the right medicine, the right prescription. So I really think there's some untapped potential with this. Clearly, with any digital element, there'll be some advantages and some disadvantages, but it's certainly something that I would strongly recommend people look at. And very briefly, and I've nicked this slide from a slide deck that we currently are utilising in the organisation around transformation. And I've kind of done this around our EPR that we're looking at the moment. For me, as I've sort of already said earlier, I'm really passionate about digital transformation, but absolutely has to be clinically led, operationally supported, and digitally enabled. So, albeit that I am CCIO and I work within the digital senior leadership team, for me, what's really important is that my colleagues feel that they are the ones that are also leading with this change. And whether that be your tiniest project in the hospital or in the private sector or out in community or in your GP practice or your local pharmacy to your biggest project, you really want to bring the people with you on that journey to be able to recognize those benefits, to be able to do that transformational change for around workflow analysis, your configuration, your comms and engagement, your education and training, and that readiness piece as well. So that kind of these pictures on here really kind of show that collaboration and really working together with people. And it's all about those tiny steps along the way and being really patient as well with people, not giving up, because sometimes you've all got ideas, and how do you bring those ideas to get the best for your patients and your staff? And for me, that's really important and something that I've learned a lot about on this journey. I didn't magically know all this when I fell into my first position back in 2014. Now, nearly 10 years later, my transition has massively changed. I've learned a significant amount. There's definitely a roller coaster of emotions along the way, but also a roller coaster, therefore, of successes as well, and challenges. I sometimes kind of put it like the tube, where there's so much going on and it's so busy, but actually I've also look at the tube diagram and think that's my network of people. And I would say to anyone that's sitting listening that feels that they're kind of siloed in their position, please do reach out. Please look at the other people that you can get support from, that you can work with, because teamwork's really essential. It's really easy to kind of be in your little bubble and think, and I do it myself, no doubt, where I'm in my CCIO world, I'm in the organization, but actually I know that I've got an amazing network of people out there that I can also tap into and reach out to. And that is what's going to really drive that digital transformation for you, no matter where you are and no matter what role you're doing. And I kind of really want to echo that for anybody that is on this call, whether you're in a clinical role or a digital technical role. Please, feel that you are absolutely part of that wider community of people that are working together to make transformational change. On that note, that is the end of my presentation. I think I've kind of timed it to perfection for the 30 minutes almost, and I'm going to stop sharing my screen, and hopefully that's worked.
Fantastic. Thank you very much for that, Ramandeep. That was, I don't think it was a whistle-stop tour. It was very informative, got all the salient points across and perfectly to time. So well done on that front. And listening to that, I was wondering, have you just described the perfect pharmacist sort of career path from leaving university to CCIO? I mean, I know there was ups and downs. We both lived through some of them, and but it does sound like there's a career path that you've definitely trodden through. Will other people take the same path? Is difficult to say, which brings sort of to the forefront the issue that there isn't really a career path exactly for people in digital health and how to get from the beginning through the middle and to the end. But we can have a chat about that in a little bit. But I like how how you went from siloed working, how you described it, using your drug chart, getting your green pen out, correcting us doctors' mistakes, spelling mainly, and what the hell are they writing there, micro or milligrams, who knows, to actually working in larger teams, to actually running larger teams. It's amazing how you've progressed through all of that. It really, really, really is. Bringing up the FCI, you bringing up the FCI, it's amazing. There's so many people I've met through this, and unfortunately, it is that the FCI is no more. There's been a lot of networking and collaboration and team working, I think, from that. It's like you and me were working on quite a bit of things in the FCI. There was professionalization. The CCIO roles, I'd really like to point this out right now for people that don't know this. Some people this is obvious, but for other people it's not. So Chief Clinical Informatics Officer. Clinical does not mean medical. And we had to make a big point of this in the FCI because a lot of people thought that just means doctors. No. It's anyone that has a clinical background, pharmacists included, midwives, ambulance drivers, and so on and so on and so on. So for people that love digital and want to get involved with this stuff, you can become a CCIO. There's nothing stopping you at all. And Ramandeep is the sort of, the example of this. Now, coming to my question, you mentioned you like computers, and that's why you got into this. Now, this might be a really, really short answer, but I'm actually curious, what is it about computers that you really like? Because it sounds like it's the drive for you to do your job. I think everyone needs a drive to do their job passionately and enjoy it instead of it being a sort of a troll to get through the day. But I'd really like to understand what is it about computers you like, and what is that drive that keeps you doing what you do?
Thanks, Mark. Thank you for the questions. Absolutely echo what you said around anyone becoming a CCIO who has a clinical role. And I would strongly recommend that people do reach out to other colleagues that are in this space to be able to have those conversations. I know you said we'd touch on the career part in a moment, and I'll come back to that. To answer your question around computers, I'm going to let everyone into an insight. I'm conscious this has been recorded, but when I was very young, which I'm clearly not anymore, I was taught how to type, but really fast typing, and for me, that just fascinated me. And I kind of have the good old floppy disks and the kind of cassette players. So it was very much around that kind of electronic kind of era. And I still have a cassette player at home, and I have no shame in saying that on this call. And some cassettes that still work. So I think for me, it's really about how fast-paced technology is and what we can do with technology, and kind of getting into the real nuts and bolts. Like if someone really did bring to me a laptop and went, could we teach you on the aspects of a laptop and how to fix it, I would learn that tomorrow. Because it's really odd that even though I've spent years, obviously, going through a pharmacy degree and then going and stepping into dipping my toe into medicine and swiftly leaving after a year for personal reasons. So it's interesting. At my last job, when I was at Barking, Havering and Redbridge, they had one of the things that we had to do in pharmacy, and again, this is something I kind of wanted to sort of highlight, is not just about EPMA, because you dip your toe into prescription tracking systems, you dip your toe into my keyboard doesn't work, can I have a new one? And my fax machine doesn't work until you realize there's no paper in it, and that's why it doesn't work. And it's all those little intricacies that actually along the way have kind of really ignited my passion for digital. So it's not just the one thing about a computer, but it also, if anyone sees me at work, they know that I want my technology to work really quickly. And it really bothers me when I get the blue screen of death, or like something's really slow. I did get the blue screen of death yesterday, and I was like, oh dear. But yeah, so that's kind of my answer to that question. Just a real passion for really quick technology and being able to go out and about. And if I had to install the smart card reader, I would, because it's just that kind of really that hands-on piece that really drives me to be able to get that transformational change done.
No, thank you for admitting some of your geekiness there. And you still have an old cassette player. I wonder if the sound qualities might have faded a bit now, but yeah, very interesting. And yeah, a lot of us had the blue screen of death, unfortunately, last week. That was not great.
No.
Right. So my next question I've got here is, and I've realized the questions I've got in front of me are sort of following your career path almost. It wasn't intentional, but
No, no.
the first one is, how does the role of a pharmacist integrate into the broader digital health strategy, particularly in the context of medication management?
Okay, yeah, so that's a really interesting question. And I think for me, around so obviously I don't know who's asked that question and what their role is. But I think what's really important, certainly from an organisational perspective, is if you are a pharmacist and you are a CCIO, or even if you're not a pharmacist but you're a CCIO, is reaching out to your chief pharmacist to get a real understanding of the digital medicines portfolio within the organisation and how that links then to your organisational's clinical strategy and your organisational's digital strategy. And not only that, but also your wider regional piece that's going on, because I do strongly believe that a lot is driven currently, certainly from the ICS view. So for me, what's really important, and one of the things that I've learned about having stepped away from being very much in that pharmacy bubble and becoming into that digital world, is needing to understand what is at the ICS level and how that impacts through, because there's obviously all the elements around funding, medicines formularies, so that has a massive impact. So I would strongly recommend, if anyone is in those positions, to be reaching out, to have an understanding, to be speaking to your chief pharmacist at that level, to also understand what are your key pinch points around medicines optimization, because there will be in every organization, there'll be something around, whether it be your VT risk assessments or your antimicrobial prescribing and your indication duration, a common one with the assessments and the guidance that's out nationally. So there's sometimes really, really key things that you can get involved in. And certainly discharge summaries, as you said, correcting pupils' errors. It wasn't me that was going to say that, you did, with a green pen.
I'm dyslexic as well, so I don't know how you guys manage me. But anyway, let's not go there. No, thank you for that. And I'm not entirely sure how much of the green pen you still do personally, but those days aren't too far behind from the sounds of it. But you do have colleagues that do this day in, day out where you're currently working. So I was wondering if I can get your point of view on this, or how you feel your colleagues have issues with this. Is how do you balance demands of clinical practice with the need to accurately and efficiently input data into digital systems, for example, your EPMA?
Yeah, so I think definitely. So for me personally, I'm not. I am still on the register, but I'm currently not clinical, purely because, as you saw from our lovely diagram, we've got lots of opportunities for people to come and work with us, which means hopefully I can then go back and be clinical. In the near future, because again, I absolutely think that that's really important, and I'm sure we could talk about that as a completely separate topic around whether you should still be clinical whilst being in a digital role. Maybe another topic for another day, perhaps, Mark, there for you. But in terms of inputting data, I think for me, what's really important is giving people that understanding around the benefit of why they're doing it. And I'm a great believer in not just inputting data for the sake of it. So actually, what is your output? Because in fact, actually, when I'd run off to the other call that I was going to do between quarter to two and this meeting, I'd gone to speak to one of our clinical colleagues, and I said, "Oh, well, if we make this field mandatory, everyone's just going to tick yes. They're not actually going to go and look in the notes and see what the outcome of that kind of field is." And I won't discuss what that is, and for me, therefore, that data would come back and it will all look like it's hunky-dory and it's 100%. But I would know that that actually is an accurate reflection. So I think in any principle, whether it be pharmacy or whether it be medical nursing, AHP, midwifery, it doesn't matter. I think what we absolutely, when we're building our digital systems and when we're building our reporting and our live flows and our dashboards, we really need to be working together as a digital technical team and a digital clinical team and our clinical and ops colleagues and our administrative colleagues to go, right, we can give you this data, but what are you actually going to produce from this data, and how does it then impact your patients, and does it drive better quality outcomes for your patients and actually give your staff some time back to be able to release back into patient care And those are certainly my principles anyway. Others may disagree on the call.
No, I think I would agree with all of those. And that sort of leads me on to your next endeavor, EPR land, and installing that next year. And as keen listeners to, the pros and cons to EPR, it can take 9 years to get a benefits realization from an EPR implementation from beginning to that timeline. I just want to know, what kind of game plan have you got for installing it, making sure there's a benefit realization, and actually collaborating with the vendor, everyone in the trust, the digital team, and everything, that huge group of people you need to collaborate with. What's your game plan, or what's your team's game plan to make sure everything aligns, the stars align nicely for you to get the best realization from that implementation?
Yeah, absolutely. I take it as an opportunity. It certainly will bring its challenges along the way, but I'd like to think that we've got a real chance to make a difference for the community, but also for our patients of Northamptonshire. But there is some strength in some of the work that's happening, particularly in the East Midlands, and I can speak on behalf of the East Midlands here. We've got an East Midlands acute provider network, and the majority of the hospitals are either on nerve centre or transferring to nerve centre. So that kind of gives us a bit of strength in numbers from a regional perspective. So I think that's really important to call out. But recognising that we're all at different steps of the journey from a regional perspective. So actually, there's got to be a lot of work done at a local level. So from our local level perspective, certainly what's really important for me and my team from a clinical perspective, and I touched on it briefly earlier, was around that engagement piece. So we had a really successful launch a couple of weeks ago and 440 people turned up, which is amazing. However, there's still another 4,500 people in the organisation to tap into. And I'm not kind of afraid to say that. I completely recognise that. And actually, it's what do you do to get people engaged? Certainly, our trolley that we've got out this morning has done its wonders with getting people engaged and spinning a wheel and giving them a free pen or a biscuit. But again, that's kind of sometimes the easier part, to be able to go around and do that. But then you want them all trained. And that's the harder part, is actually getting people to step away from what they're currently doing, get everyone trained, get everyone ready on these systems, tackle that resistance as well. And there will be, because undoubtedly people will have come across things that they've either utilized before, they've utilized different systems before, or they may have put a request in for something to be changed and it hasn't happened, or they're still utilizing a bit of paper. So our plan is one that's going to be very fluid. I think that's safe to say. One that's going to involve a lot of people that we're recruiting that are not just from a digital clinical perspective, but we're recruiting people who are transformation specialists, we're recruiting people from a technical perspective, to all be really working together to understand what is the as is right now out there, and then translating that into to be. We're doing a lot of sessions around discovery as well, so actually trying to understand what is happening on the ground, what do people want, what's one of the other things that we've done is like a wish tree. So actually, what are people's wishes now? But also, for us, what's really important is about setting those expectations and getting people to recognize, like you said, that this, albeit we do have a very ambitious plan for the next 2 years, the contract is much longer, and therefore there will be a period of optimization. And that's really important. And I think certainly one of the things I've highlighted, therefore, and that I picked in the slides earlier, is around that having the people in your teams for business as usual, because that cannot be forgotten, because if you don't have that, your optimization falls down. So I think it's really important. Find what's your real core principles that you need to digitalize. And I think for me, what's really important as well is, and a game plan would be around not just digitizing, but then digitalizing. And they're two slightly different things, because you actually don't want the same 5 documents that get filled in for the patient. I've come in, I've asked the patient what their smoking status is, for example. They then go to another ward, you come and ask the same question, then another person comes to see them and asks them the same question, and we really need to step away from that. So a lot of the work, and I've seen other colleagues in other trusts do things like this, is paper picnics. So really trying to get all the paper together and really kind of streamlining that and making it better for the patient, so the patient has a better experience as well.
Yeah, thank you for that. I like to think
That
of
was
it
quite a
as
long answer, sorry.
no, it's really good. No, I like to think of it as, coming to your last point, not as digital transformation, but transformation with the age of digital if it's appropriate. I mean, you can turn a piece of paper into a PDF, that's digitized. Is that useful? I would argue very much no.
Yeah.
And that brings me to the training bit. I want to jump to that question before, if we run out of time, I want to get onto that question. As you probably know, me here in Let's Do Digital, I'm very much into digital literacy, confidence, I think was the word you used.
Yeah.
And, we've got coding courses, we've got these webinars. We want to do the handbook of clinical informatics. We're calling it the essentials of health informatics. So watch this space, that will be coming out soon. But, we were trying to do this in the FCI, now in the British Computer Society, the FedIP is doing some bite-sized learning bits on this as well. There's scattered learning of digital across the country in different trusts, different universities. I've seen you and me have both done the NHS Digital Academy. But at a local level, I'd really like to hear what you are doing to help train your staff, be they clinical or admin, or even patients.
Yeah, thank you. It's certainly something we've got some work to do on. I think that's fair to say. I'm not going to sit here and go, I've got the perfect answer, because I don't. And which is why we are going to be releasing very soon the digital confidence survey in the organisation, because we really want to understand that kind of baseline metrics to then help us develop those next steps. Because there will be some people who will only need to know how to access their emails because their role only requires them to know how to access their emails and how to access their payroll and ensure that they get their pay slip. Whereas there'll be some people who absolutely need to access all of our digital clinical systems, be able to look after our patients and know how to use everything. And then there'll be some people kind of in the middle who will have sort of different responsibilities and won't necessarily need all of the systems, but we'll need some really specialist systems. There will also be some of the people who are complete advocates for digital. So we have a digital champions network set up within the organisation, and that's been going on for a number of years now. So one of the things that we're actively trying to recruit people to for our EPR, we've also put out a survey where we've said, if you'd like to be involved in the EPR, please fill this out, and then we'll kind of pull all those people together. So we've got active Teams channels running for them. One of the other things that I have, and maybe perhaps there's some working that we could all do together on this, or if anyone's interested on this call, because I did the Digital Health Pioneer Fellowship a number of years ago now, that for me was really a kind of whistle-stop tour, but really valuable tour of digital in a nutshell, and some of the really core baseline principles that those that are kind of digitally passionate and are slightly more digitally passionate than people who actually just need to use the systems but aren't quite interested in wanting to have any more enhanced training, but then not go through, for example, like we've gone through and done the whole digital academy. There'll be people in the middle who want to know more about digital, who'll be really excited, but don't have time to do the Digital Health Academy or any of those other courses, or go and do a master's in health informatics and AI, because they're lifestyle choices. Let's be fair. They are definitely lifestyle choices to do, to take the time out to do. So I'd really like to do, and something that I'm putting together is a kind of almost one of those kind of sessions for people that is, you're in that middle zone that you really want to know more. You don't have time to go and do really intensive formal training around digital. So what can we offer, and is there something that we can all collaborate on, a couple of us in different organizations, and perhaps thinking about what you've just touched on around the handbook. So bringing that together, so that's something that we're looking at doing as well. So kind of measuring digital confidence, getting the results of that, and then kind of teaching our organization and helping people with those skills, looking at the kind of middle piece. And then from my perspective, certainly with the colleagues that are in my team, I've set out in the appraisal objectives things that would be applicable for the different colleagues in my team, so that they get the opportunity, if they wanted to delve into mentoring, to delve into looking at the BCS, the Shuri Network, clinical safety training, TOPOL fellowship, digital health fellowship. So there's so much. And I think, again, that's the other thing I would say, that you don't need to have done everything to get to where we've got to. You might be interested in coding, you might be interested in AI, you might be interested in actually just general broader principles around the generic piece. So I think there's different levels of training depending on who you are. And then certainly from an EPR perspective, there's the one last thing I would say, and much, much more on a local level and much more related to clinical systems, is around thinking about the different tools and techniques that you can utilize to teach and train people, because not everyone will want to learn the same way. So it's, for me, what's really important is being able to mix that approach around hybrid, around teams, around face-to-face, being able to do short bite-sized videos, because I think there's some research out that showcases that that's really valuable as well for people to kind of get really short videos in to get training done, because people just don't have the time, especially when we're so stretched clinically. So quite a varied answer there, but hopefully quite a mixed one.
Thank you. We've got time for one quick question, and I'll see how you like this one. It's very future looking. What future trends or technologies do you foresee having the most significant impact on digital healthcare?
Oh, that's an interesting one. What future trends do I foresee? So certainly I think there's a lot in this space. So I'm going to answer that in two ways. One, around AI. So I definitely think there is a lot of untapped potential in that market, albeit comes with it a lot around clinical safety and patient safety. There is definitely, and I know Saboth touched on it in his presentation too, there's technologies now that can sit in the background and listen to a consultation and summarize it. Is that the way we want to go? Do we want to make all that kind of real, as it were? So I definitely think there's some trend around that that's going to come out, and linked with that also the federated data platform. We certainly don't have time to talk about that in 1 minute, but if anyone's interested in that, certainly go and have a look, and I'm sure NHS England will delightfully give you a presentation on that as well, because there's lots of untapped potential in that area from what I've seen. And we saw that at summer schools in a presentation on that last week in Durham. And I think the other area and the other trend for me is linked back to digital confidence and really tapping into that, but also something that I'm really passionate about that we didn't quite touch on, but you mentioned it earlier, is around that undergraduate training piece and bringing it into the grassroots. Because I think for me, I haven't had the perfect kind of linear route to get to where I've got to by no stretch of the imagination. But also, I think the other part that is something that we need to consider, and hopefully will come out of the Digital Clinical Leaders Survey, is thinking about what's in a name. Does it actually matter? And I've spoken about that before at conferences. Does it matter that my title says CCIO and somebody says something different? And what is life after becoming a CCIO, a CNIO, a CPIO, a COIO? The list goes on. Apologies to anyone I've missed. That is not intentional. You may have heard me talk about it before. So I think there's definitely some very different trends there. There's no doubt other things as well around digital transformation, but I'm very mindful of time. So certainly lots to tap into for the future.
No, fantastic. Thank you for that. Right. Ramandeep, thank you for giving your time now. I just want to do a little plug for what we're doing at Let's Do Digital before we all disperse. So we've got quite a few of our coding modules. So I'm a clinician of codes, and I've been writing these modules. I've got quite a nice list of tutors who are helping out run these courses. What I haven't got on this, and this is on the Let's Do Digital website, what I haven't got on this list at the moment is some other webinars coming up. We're going to have our first Ask Someone in Digital webinar with Jeff Ravill, who is the co-founder and CEO for Safe Space One Limited. So he's very much into cybersecurity. He cringes at the idea of AI listening to our consultations. He's not very happy about that, especially if data goes to the cloud. And then we also got Anita Pung and Dom Main talking as well about their sort of Ask a Clinician side of being a GP. Anita works for Lindus Clinical Testing, and Dom for Health Tech One, and he's also a GP. So watch out for Jeff on the 5th of September and Anita and Dom on the 13th of September. Ramandeep, thank you again for coming on to tell us all about your journey. Hopefully other people will actually take the same sort of journey or learn from what you've done, and take some of your experiences to help them get to where you are today. It's been a really enlightening talk with yourself, and I'd like to thank everyone that came along to listen in. Thank you for coming.